Good evening. My name is Daryl. I'm going to be your nurse for tonight. Can you tell me your name and your date of birth?
Kelly Shower, 12/30 of 65.
Okay, perfect, Miss Shower. What I'm going to do today is I'm going to do a neurological exam, which includes checking your reflexes and your coordination. I'm also going to look at your eyes, nose, ears, and mouth. Is that okay?
Yes.
All right. So I'm going to start off this assessment by asking you a couple of questions. Do you know what day of the week it is?
Yes, Friday,
Okay, and do you know what the date is?
July 5th.
And I know this one's a little crazy, but can you remember what you had for lunch yesterday?
A ham sandwich.
Okay, perfect. So I'm going to start this off, the physical part of the exam, by palpating your lymph nodes, okay? So I'm going to feel on both sides. You'll feel me gently pressing in a circular motion on your face, okay? So start right here, and then back there, and then our occipital. Move down to our superficial cervical and our submental and submandibular. Our deep cervical or down, have to push a little bit harder, sorry. And then our supraclavicular right here. There's no enlargement of any lymph nodes. You didn't feel any pain during that assessment, did you?
Mm-mm.
Okay, perfect. Next, I'm actually going to check your thyroid. So I'm going to put my hands right around your neck like that. Can you swallow for me? Okay. And swallow again.
I can't. Hold on. There you go.
Okay, I have to be feeling it though to palpate your thyroid. Okay, perfect. Okay, we're going to take a look at your vision now. So you are allowed to keep your glasses on for this exam. What I'm going to have you do is hold this eye chart at arm's length away and
Okay.
cover one of your eyes with this sheet of paper.
All right.
And read the lowest line possible for me.
LTFPH.
Perfect. Now switch sides.
LTFPH.
Perfect. So even though we have our glasses on, our vision is still 20/20. That means they are doing their job. So now I'm going to check your peripheral vision fields and something called a confrontation test. So what I'm going to do is have you cover one eye, and I will cover my opposite eye, and you let me know when you can see my wiggling finger, okay?
Mm-hmm. I can see it. I can see it. I can see it. Yes. Yes.
Perfect. Now let's switch sides.
Yes. 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 Yes.
Perfect. So there's no peripheral vision loss noted. And our fields are normal bilaterally. This is testing your cranial nerve 2, which is your optic nerve. Now I'm just going to have you follow my finger without moving your head, only move your eyes, okay?
Okay.
Perfect. I'm going to use this pen light now. I'm just going to take a look in your eyes to see how your pupils react.
Okay.
If you could remove your glasses for me for 1 second. Thank you. Just a quick light shining through. And I won't get too close. I know this is uncomfortable, but I'm just going to slowly move my pen light towards and away from your face. Okay, so perfect. Our pupils are equal and round. They're 4 millimeters and they constrict to 2 millimeters. They're reactive to light and they accommodate. So I'm now going to check something called your corneal light reflex. So once again, I will just be shining a light in your eyes, not coming towards or away from them.
Okay.
I'm just looking for a light. Okay. So the light was seen equally. It was in the same spot in both corneas, exactly how it was supposed to. We're going to transition to assessing your ears now.
Okay.
Okay. So first I'm going to look at them from the outside. I see no redness, lumps, drainage, no abnormalities noted. Do you feel any tenderness?
No.
Okay, now I'm gonna move to the other side. Going to do the same thing. Our ears both look symmetrical and equal. There's no redness, drainage, abnormalities, or lesions noted on this ear either. Any tenderness?
No.
Okay. So next I'm going to do something called the whisper test, which I will have you close one ear
Okay.
by just pushing down on your tragus, and I will go on that side, whisper a combination of letters or numbers to you,
Okay.
and you just tell me what I whispered to you.
Okay.
Okay? So which side would you like to start on?
I don't know.
Okay, I'm gonna come to this side. A-2-O.
A-2-O.
Okay, perfect. I'm gonna come to this side, we'll do the same thing, but with different letters. 5-M-B.
5-M-B.
Perfect. So doing this, we're going to move on to another test that we do called the Weber test and a Rhine test. And those include using these tuning forks. So for the Weber test, this is where I'm just going to make a ringing noise come from this.
Okay.
And you tell me if you can hear it more in the left ear or the right ear,
Okay.
or if they're equal,
Okay.
okay?
Equal.
Okay, perfect. And now the Rhine test. This one will involve me gently placing the base of the tuning fork on your skin.
Okay.
You're going to tell me if the ringing noise is heard louder in front of your ear or behind it.
Okay.
Okay?
In front.
Let me do it above, okay, real quick, and you let me know comparison.
Am I supposed to be answering?
Which one do you hear the vibration louder, in front or above?
Above.
Okay, perfect. So I'm gonna move to the other side and we'll do the same test. Okay, now above.
Above.
Above again? Okay. Do they feel about the same in each ear? Or
Yes.
Okay, perfect. So now I'm going to take a look in your mouth, nose, and throat and
Okay.
do that assessment. Okay, so first I'll ask you to open your mouth for me and say ah, stick your tongue out. Okay, perfect. Our uvula is midline and tonsils are intact. I'm going to use a tongue blade just to take a peek in there. Say ah. Our uvula and tonsils move appropriately, and I do know that there is a gag reflex because earlier I barely had to touch. So that's perfect, that's intact. I know,
nice,
that's
thank
the
you.
worst part. It is checking your cranial nerve 9, which is your glossopharyngeal nerve, and your cranial nerve 10, which is your vagus nerve. All right, we're gonna move on to the nose now. Have you noticed any changes in your sense of smell lately?
No.
Okay, so I'm going to have you close your eyes, cover one nostril, and I will place something for you to smell, and you let me know what it is.
Candle.
Perfect. We're going to do the same thing, but on the other side.
Onion.
Perfect. All right. So we already looked at your cranial nerve 2, which is the optic nerve, when I looked at your eyes and your vision and inspected each one. Now your cranial nerves 3, 4, and 6, which are the ocular motor, trochlear, and abducens, were checked earlier also, and there was no ptosis or signs of nystagmus noted. Your cranial nerve 5 is your trigeminal nerve. So how I will check that is I will have you clench your teeth, and I'm just going to feel your muscles that are involved in that. Perfect. These muscles feel equally strong on both sides. Keep your teeth clenched. I'm going to try to pull down your chin for it to work against me. Perfect. And I'm going to gently touch you with an item, keeping your eyes closed. You just let me know when you're able to feel my touch.
Okay. No. No. No.
All right, perfect. Cranial nerve 7 is your facial nerve. So one of the ways that I can check this is having you smile for me and frown. Close your eyes tightly, and I'm going to try to open them, okay? Perfect. And now puff out your cheeks, and don't let me push the air out. Perfect. Cranial nerve 8 is the acoustic nerve, and that was already tested earlier with the whisper test, which that you passed with flying colors on. Cranial nerve 11 is your spinal accessory nerve, and the way that I test that is I will push down on your shoulders and you shrug up against me. Perfect. I'm going to place a hand on your cheek and you turn your face towards me. Feel the resistance. Perfect. And these movements are equally strong on both sides. Cranial nerve 12 is the hypoglossal nerve. Can you stick out your tongue for me? All right, you put it back in, and can you say light, tight, dynamite?
Light, tight, dynamite.
Perfect. So the letters L, T, D, and N are all clear and distinct. So testing your coordination now, I'm going to have you pat your knees and then turn your hands over and pat with the front and back. Perfect. So we're going to check your gait and how well you walk now. So I'll have you stand up for me. And I'll have you walk towards that lamp over there. And then on your way back, walk on your toes if you can. Perfect. Our gait is steady and smooth. Actually, no, I can test this by, I want you to stand up without using your hand or the ottoman to help yourself up. Perfect. Now stay standing. Now I'm going to do something called the Romberg test. So I will have you put your feet together, put your arms at your side, and close your eyes. We'll stay like this for 20 seconds, okay? This is taking a look at your balancing. Perfect. You can sit back down for me. We had no issues with our balance, and she was steady standing there, and I was not ever worried that she would fall down. And posture was maintained. So I'm going to do something that tests the spinothalamic tract, which is a tongue twister. I'm going to have an item that is sharper on one end, dull on the other. And with your eyes closed, you tell me if I'm touching you with the sharp side or the dull side, okay?
Sharp. Dull. It barely touched me. Okay, sharp. Dull. Sharp. I think that was dull. Dull.
Perfect. And then when you can feel my touch with your eyes closed, you tell me when, okay?
Okay. Now. 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 Now.
All right, perfect. So our sensation is equal bilaterally. So now what I'm going to do is you're just going to feel a vibration at your base of your thumbs and then at the base of your big toes.
Okay.
You let me know when you feel it, okay?
Okay. Feel it. Yes, feel it. Yes. Yes.
Perfect. So we are able to feel a vibration in all of our extremities. Now assessing our posterior column tract. And there's no signs of peripheral neuropathy noted. With your eyes shut still, I'm gonna have you hold your arms out. And you tell me what arm I am touching and if I am moving it up or down.
Left arm down.
Okay.
Right arm up.
Perfect. So there's no sense of position loss. So eyes closed still, I'm going to give you an item in one hand and I will ask for you to identify it for me.
A key.
Okay, perfect. And a different item in the other hand.
A pen.
Perfect. Keeping your eyes shut, open up your hands so your palms are towards me. I'm going to trace a number and you tell me what number it is, okay?
2.
Perfect.
Five.
Yep. All right, now I'm going to use something else that's a little bit sharp, but I'm going to test your sensation with this too. I want you to tell me if I'm poking you with 2 items or just 1.
2. 1. 1. 1. Oh no, I'm not
Okay.
sure.
There's a
One.
slight deficit in the sharpness of the items felt on that extremity. But now it is time to check your reflexes. I promise that we're almost done with this. I'm going to start with our biceps. So I'm just going to have you relax your arm, turn it towards me. Okay, perfect. This time we'll do the same thing. Now we're going to test your tricep reflexes. Relax your arm. So far with our bicep and tricep reflexes, they're +2 bilaterally. I'm going to check your brachial radialis. Be nice and gentle with this one. Okay. Okay, those are +2 bilaterally. Going to come down to the classic quad reflex, which is also the knee jerk. Okay. Okay. Perfect. So they're +2 bilaterally also. And then down to our Achilles, which is the ankle jerk. Okay. Those are also +2, and then I'm going to check your plantar reflex. So you're just going to feel this item on the bottom of your foot, okay?
Mm-hmm.
Okay. And both reflexes are reactive and +2. So, all right, Mrs. Shower, I have completed my assessment. Do you have any questions for me about any of that?
No.
All right, so I'm going to go get some charting done. You let me know if you need me before I step back in, okay?
Okay.